Good morning. I'm sorry for dressing less formally than others. I didn't take out my jacket, but
we can fix that.
So my name is Hung. I'm working for International Livestock Research Institute INRI in Hanoi, and in the same time, I'm leading a small group research called Center for Ecosystem and Public Health Research at Hanoi School of Public Health. So in that sense, we work a lot with national and local partners. Having listened to two speakers and also ideas and points of our colleague here, I would like to raise two main points from my perspective. You see, when we talk about food security, maybe in Asia, in particular Southeast Asia or Vietnam in particular, where I come from, the context is a little bit different because we basically we are able to cope with the security. A lot about the safety of food in the country, and people are really willing and ready to pay more to have higher quality of food. But like you said, when you have money, it doesn't mean that you can buy the high quality of food in that kind of setting. So the point I want to mention here, and this is also my first point, is in fact, we are having really big gap between the policy and the academic world. So we started doing some work with INRI and IFPRI and in Hanoi by really bringing policymakers from Ministry of Health and Ministry of Agriculture to work with researchers in food safety. Because food safety management is very much intersectoral collaboration in every country. And through the discussion, we understand that, what we are doing from the research perspective, like Delia mentioned, on this burden of disease, what is the most important hazards, etc. It's not necessarily the things that policymakers, they think about. They think more about the attention of the public when they talk more in Vietnam now about, chemical hazards, on this cancer issue, antibiotics residues. And from the research perspective, you can do a lot of study and you show, microbial hazards cause much more burdens of disease. And this thing is not matching together. So the first point here is, in fact, I think that through science and through research, we need really to find the common language and common understanding between the policymakers and the researcher so that we can do the common things and really transfer the research result into the policy from the policy making point of view. So this is my first point. And of course, again, Peter, you asked where is the science there? Of course, science is there. Because with research, you can show what would be the important issue in food safety. And when policy making and, once they understand that, I think that, it's much better to work through this thing. And of course, I can argue with Delia that, is the incentive is important, but in some context like Vietnam, it's very much centralized, you are communist, socialist country, etc. So, if you have the law, if you have regulation, enforced nicely, so the impact, can become bigger very quickly. So this is also the different between setting. The second point I would like to mention here, and also respond to the question of John about, what kind of research question we can do in terms of food safety research. And now, we can say also that we have not enough knowledge and science information about food safety, but here and there we have a good understanding about the situation. And we need now quickly to move from research into intervention to really reduce the burden of disease caused by this food safety thing. And in some of the settings in the country, you can see that, for example, INRI is working with national partners about a project funded by ACIR about pork value chain and food and safety of the pork using reassessment and things. And we can see basically where it's really the problem come from. For example, the slaughterhouse is very critical for food safety for pork, for example. And the practice over there is, in fact, they slaughter on the floor, etc. So you can see by basic, not so sophisticated or fancy technique, you can improve the situation in terms of hygienic practice of slaughterhouse by hanging or by creating the simple support to not slaughtering pig in the floor, but also a kind of hanging system, then you can reduce the contamination from that. And also the examples that Delia showed in Vietnam, the supermarket pork sometimes is more contaminated than the informal market because of different reasons. But it's not only about the contamination of the pork, because in Vietnam, basically, we cook very well. And it looks like that the health issue comes more from the cross-contamination problem in the country. So when you talk about cross-contamination, you talk about environmental perspective around the production side, about the slaughterhouse, etc. So the issue of food safety here, in terms of the community, should go beyond the meat that we are talking about, but we talk about vegetable, but also as a contamination because due to the livestock system. And from that point of view, I would say that we need more integrated approach to research when we deal with food safety. It's not only pork, it's not about chicken, but it's also vegetable. And the so-called One Health or eco-health approach we are looking at the moment is not only human health, but also animal and environmental health should be taken into account. So the second take-home message, and also is my last one here, is also moving really from policy and research linkages that we need to work on to the simple or maybe locally adapted and socially accepted intervention or measures to control food safety in specific context should be important by using the integrated approach like One Health and Eco Health. So thank you.
Thank you, Hung. You mentioned cross-sectoral and cross-contamination. What did the partnerships look like in these types of cross-sectoral? I mean, you're from a public health side as well. How do you really get these different groups working together? Is there a different partnership picture than in other areas?
Okay, these two crosses not the same, you see, sectors and contamination. You are right, I mean, I'm a biologist by training, but I have been sitting at a public health institution, so it was a little bit our advantage also to work with health people. But now with the new law of food safety, Ministry of Agriculture, they have more power basically on food safety because they manage more on all this production side until the slaughtering and also some consumption thing. So you see, you have some political wins in the country bringing Ministry of Health and Agriculture to work together. Also, you have also science, technology, environment, etc. But the key ministry are really Ministry of Health and Agriculture. But this happen at the high level. So us from the academic level, we could identify what would be the niche of this partnership setting. Then, for example, they want to do risk assessment to manage food safety in Vietnam. And we know that as a ministry level and research institutes, we have very little capacity. And we jump in and we bring people to work together. And because they need that things, so they collaborate with them. So this is basically the...
So where is the capacity that you're looking for?
So for example,
somewhere else.
The risk-based approach need very specific, technical skills to do risk assessment. It's basically scientific things. And when you have things like this, you can give to policymakers, then they decide from the management point of view. And ministries, they have also some research institute belonging to the ministry, and you have university people also. But but we understand that risk assessment, risk-based approach is a little bit new to this kind of setting. So we come to work with them to develop or to build up the capacity in risk assessment in that sense. Okay.